Good morning, my dear students. Welcome to our online discussion for Health Education Quarter 4. At the end of this discussion, you must be able to explains the non-communicable diseases based on cause and effect, signs and symptoms, risk factors and protective factors, possible complications, practices ways to prevent and control non-communicable diseases. Lastly, corrects myths and fallacies about non-communicable diseases. Prepare a pen and paper for your activity 1. List 5 examples of communicable and non-communicable diseases using your pen and paper. You will have only 1 minute to complete exercise 1. Be ready, because 1 minute starts now. Good job. Let's review your responses at the end of our discussion. MELC 1. Differentiate communicable and non-communicable diseases. Disease is a condition that prevents the body or mind from working normally. 2 types of diseases. 1. Communicable diseases are illness that can be transferred or passed from one person to another. 2. Non-communicable or chronic diseases are non-infectious illnesses. Communicable diseases are diseases that spreads from one person or animal to another. Pathogens such as viruses, bacteria, and fungi cause these diseases. Common communicable diseases are dengue, diarrhea, chickenpox, influenza, acute respiratory infection, tuberculosis, sore eyes and AIDS/HIV. Non-communicable diseases are non-infectious illnesses which may result from hereditary or lifestyle factors and not from pathogens. NCDs are usually caused by genetic or lifestyle factors. In this video we will focus on common non-communicable diseases, cause and effect, signs and symptoms, risk factors, and protective factors. Allergy is synonymous to hypersensitivity, which refers to an exaggerate response to an antibody-forming substance or antigen. Cause: food intake, vaccine or blood transfusion, insect sting, skin contact, or through nasal by smell. Signs and symptoms: swelling of the mucous membrane, redness and itching of eyes, impaired hearing, rashes, and headaches. Asthma is a chronic condition in which breathing becomes difficult. Cause: dust and molds, pollens, cold air, weather change, sinus infections, stress, and certain foods. Signs and symptoms: shortness of breath, wheezing, coughing, chest tightness. Cardiovascular disease is a disease of the heart and blood vessels. This disease is the leading cause of mortality in the Philippines. Types of cardiovascular disease are coronary heart disease, heart attack, angina pectoris, rheumatic fever, heart rhythm abnormalities or arrhythmia, congestive heart failure, and stroke. Coronary heart disease occurs when coronary arteries are narrowed or blocked by waxy substance referred to as plaque. Coronary arteries supply oxygenated blood to the heart muscles. If the flow or oxygen-rich blood to the heart is reduced or blocked, a serious heart problem, like heart attack, may occur. Heart attack: the death of the heart muscle due to the lack of blood flow to the heart. The coronary arteries, narrowed by plaque, become clogged by clot and blood flow to the heart muscle is blocked. Signs and symptoms: uncomfortable pressure or pain in the center of the chest, pain that spreads to shoulders, neck, and jaw, lightheadedness, sweating, nausea, and shortness of breath. Stroke, also known as cerebrovascular accident, occurs when blood vessels in the brain are broken or blocked. Blood cells, which are supported by the blocked artery, will not receive oxygen and will die in minutes. The affected part of the brain cells, including the part of the body it controls, will not work. The most common cause of stroke is blood clot in an artery of the brain, which causes aneurysm, a weakened part of the blood vessel. When one aneurysm bursts, it may result to stroke. Signs of stroke, according to the American Heart Association, FAST, is an easy way to remember the signs of stroke. F. Face dropping. Does the face sag on one side or numb? Ask the person to smile and examine if the smile is uneven. A. Arm weakness. Ask the person to both arms. Can the person keep arms lift up? S. Speech difficulty. Is the person's speech slurred? Do you understand what the person is saying? T. Time to call. If the person shows any indication of the following signs, call for emergency and get immediate hospitalization. Remember the time when the first signs occurred. Reducing risk of cardiovascular diseases. 1. Maintain a healthy blood cholesterol level and choose a heart-friendly diet. 2. Avoid smoking and secondhand smoke. 3. Maintain a healthy blood pressure. 4. Maintain a normal body weight. 5. Participate in regular physical activities. Cancer, caused by abnormal cells growing without control. Abnormally dividing cells can form a tumor, an abnormal growth of tissue. A biopsy or microscopic examination of tissue is done to determine if a tumor is benign or malignant. Difference between malignant and benign: malignant is cancerous. Malignant tumors can spread infection and destruction of nearby tissues and other nearby tissues and other body parts. Benign is not cancerous. Benign tumors may increase in size but do not infect other body parts. They are typically harmless unless they are in a position where they block normal tissues or organs. Ways to treat cancer through 1. Radiation therapy uses high-energy radiation to kill or damage cancer cells. This treatment is usually performed using radiation-generating machines. 2. Chemotherapy treatment using anti-cancer drugs which kill cancer inside the body. Anti-cancer drugs target mainly cancer cells, although they may harm healthy cells as well. 3. Immunotherapy, treatment where the immune system is stimulated to fight cancer cells. Reducing risk factors of cancer. A. Identify the signs and symptoms of cancer. Early detection of cancer has higher success rate of treatment. The acronym CAUTION is recommended by the American Cancer Society. B. Have a regular checkups. Regular screening tests, like the pap smear for women and digital rectal exam for men, can detect cellular changes before they become cancerous. Mammogram may be able to detect breast cancer early. C. Avoid smoking and secondhand smoke. Cigarettes contain carcinogen, which are substances that cause cancer. D. Avoid too much sun exposure. Ultraviolet (UV) radiation from the sun and frequent exposure increases the risk of skin cancer. Avoid being exposed to sun from 10 a.m. and 3 p.m. especially during summer. This is when the sun's radiation is strongest. Wear sunscreen lotion and cream when you spend time outdoors. E. Eat your fruits and vegetables. Fruits and vegetables provide antioxidants which help repair damaged cells. F. Observe the meat you eat. A study suggests that high animal fat can lead to the development of certain cancers. Large intake of smoked foods, salted fish and meat, and pickled vegetables increases your risk factor for cancer. G. Exercise and have the right weight. An overweight body significantly heightens risk factor for developing cancer. Exercise helps gain and maintains ideal weight, which is a vital defense to counter cancer. H. Be aware of family's history of cancer. Some types of cancers go on more frequently in certain families and can be due to genetics or hereditary factors in family's environment or lifestyle. I. Avoid drinking alcohol. Regular excessive intake of also increases risk factor for cancer. K. Practice abstinence or safe sex. HIV and sexually transmitted diseases, STDs, can develop to different types of cancer. Diabetes or diabetes mellitus, a disease in which the body produces little or no insulin. This happens when the pancreas does not produce enough insulin or produces insulin but does not help cells break down sugar. This results in too much sugar or glucose in the bloodstream. Diabetes cannot be cured but can be controlled. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin. Insulin is a hormone needed to allow sugar, glucose, to enter cells to produce energy. Symptoms include increased thirst, frequent urination, continuous hunger, weight loss, blurred vision, and tiredness. Individuals with type 1 diabetes must take daily injections of insulin to stay alive and follow a special diet. Type 1 diabetes usually occurs in children and young adults. Type 2 diabetes, or non-insulin dependent diabetes, occurs when the body produces insulin but cells cannot use it. This type of diabetes can be managed with oral medication and through a program of diet and exercise. Symptoms are not as noticeable as type 1 diabetes and may go undetected for many years. Gestational diabetes occurs in certain females during pregnancies. It is when the body does not respond to the produced insulin, which is caused by hormones. It is treated with diet and not with oral medications, for it may harm the baby. Usually, gestational diabetes recedes after childbirth, but women who had this is at a higher risk of developing type 2 diabetes. Diabetes prevention is important, especially if you are at an increased risk for the disease. Certain factors that increase the risks for diabetes include the 4 F's: being fat or overweight, being female, family history, and being 40 years of age or older. The following tips can help in preventing diabetes. Get more physical activities, include fiber and whole grains in your diet, lose the extra weight, make healthier food choices. Arthritis is a painful inflammation of joints that affects the muscles, tendons, and ligaments surrounding the joints. Common symptoms of arthritis include joint pains, swelling, stiffness, and inflammation. Types of arthritis include osteoarthritis, normally affects the hips, knees, and hands with pain, stiffness, or inflammation. It is caused by normal wear and tear as we age and may be worsened by infection or injury to joints. Rheumatoid arthritis frequently appears on hands, wrists, and feet, and can also affect other body parts besides the joints. It is caused by the body's immune system attacking the tissues of the body that leads to destruction of both bone and cartilage inside the joints. Psoriatic arthritis is a form of arthritis that affects some people who have psoriasis, a condition that features red patches of skin topped with silvery scales. Most people develop psoriasis first and are later diagnosed with psoriatic arthritis, but the joint problems can sometimes begin before skin patches appear. Managing arthritis. 1. Perform physical exercises that help in strengthening the muscles around joints. 2. Lose and keep a healthy weight. 3. Take medicines like aspirin and some prescription medicines that will help alleviate the pain and other symptoms. 4. Take hot baths that can help reduce swelling and pain. Renal failure, also known as kidney failure, is a condition where the kidney stops to function properly, causing renal insufficiency. The kidneys remove the waste products from blood and help regulate blood pressure, balance electrolytes, and red blood cell production of the body. Symptoms of kidney failure: changes in urination, foamy or bubbly urine, urinating more often in greater amount with pale urine, urinating less often in smaller amounts with dark-colored urine, urine with blood, difficulty in urinating, swelling in legs, ankles, feet, face, or hands, extreme skin rashes and itching, nausea and vomiting, shortness of breath, feeling cold, dizziness, and concentration problems brought about by anemia related to kidney failure. How to prevent and manage kidney failure: avoiding or limiting intake of toxic substances will help prevent kidney failure. A key to prevent severe kidney disease is early detection and aggressive intervention. Diabetes and high blood pressure are commonly associated with chronic kidney diseases. Managing them with proper diet, exercise, and medications may help prevent kidney failure. Severe kidney failures are treated through dialysis and kidney transplant. These are usually on the late stages and can be lethal. Fact file: World Health Organization. Non-communicable diseases, NCDs, kill 41 million people each year, equivalent to 71% of all deaths globally. Each year, more than 15 million people die from an NCD between the ages of 30 and 69 years. 85% of these premature deaths occur in low and middle income countries. 77% of all NCD deaths are in low and middle income countries. Cardiovascular diseases account for most NCD deaths, or 17.9 million people annually, followed by cancers, 9.3 million, respiratory diseases, 4.1 million, and diabetes, 1.5 million. These four groups of diseases account for over 80% of all premature NCD deaths. Tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diets all increase the risk of dying from an NCD. Detection, screening and treatment of NCDs, as well as palliative care, are key components of the response to NCDs. Now, let us check your activity. 1. Example of communicable diseases are coronavirus, smallpox, common cold, whooping cough, malaria, tuberculosis, cholera, rabies, pneumonia, diarrhea, HIV, hepatitis A, B and C, measles, salmonella, and blood-borne illnesses. Most common forms of spread include fecal-oral, food, sexual intercourse, insect bites, contact with contaminated fomites, droplets, or skin contact. NCDs, which include diseases such as cancer, heart disease, diabetes, stroke and chronic respiratory diseases, account for 68% of all deaths in the Philippines. Take a picture of your responses and upload it to our separate group chat during our scheduled time. Prepare for activity number 2. This activity number 2 will put your listening skills to the test. Look for the term that the statement is describing. Write your response on your paper. 1. A condition that prevents the body or mind from working normally. 2. Fail to adequately filter waste product from the blood. 3. Masses of cells that are cancerous. 4. Masses of cells that are not cancerous and do not spread. 5. Excessive urination. 6. Another term for hunger. 7. This synonymous to hypersensitivity. 8. Abbreviation way to remember the signs of stroke. 9. Abnormal cells grow, they form in masses. 10. Chronic condition when breathing becomes difficult. 11. Review your answer. I will post instructions in our group chat for the submission of your answers in Activity 2. Question time 1. Why do we need to correct myths and fallacies about non-communicable diseases? 2. As an adolescent, how can you prevent and control non-communicable diseases? Explain your answer briefly using 4 to 5 sentences. Write your answers in the comments section. Like and subscribe into my channel for more video lesson.